You're busy, right. And you want to get a real handle on important stuff without getting totally bogged down. That's what we do here on the Deep Dive. Today, we're looking at something pretty important for pet owners, leptospirosis. Mostly in dogs, but we'll touch on cats a bit too.
Yeah, and to really get into it, we've been using a great source, the Canine and Feline Leptospirosis Guide. It's what the vets often use. Very comprehensive.
Exactly. So our mission, really, is to pull out the crucial bits from this guide. We want to break down what lepto is, how it affects dogs mainly, and the key things you need to know, without making your head spin with jargon.
Right, keep it practical.
Okay, let's dive in then. What exactly is leptospirosis? Can you give us the simple version?
Sure. So in simple terms, it's a disease. It can be short-term, acute, or hang around longer, chronic. And it's caused by these bacteria. They're called Leptospira.
Oh, yeah, got it.
And while lots of animals can get it, we're really focusing on dogs today because they're affected much more often. Cats, very rare.
Okay, dogs primarily. And what kind of problems do these bacteria actually cause in dogs? What are they doing?
The big things, the main targets in dogs are the Achilles, causing inflammation. That's nephritis in the liver, causing hepatitis, liver inflammation.
Vein and liver, right.
And here's something interesting. The specific types of these bacteria, we call them serovars, that cause the disease, well, they vary. Depends where you are geographically.
Ah, so it's not the same bug everywhere. That must matter for things like prevention.
Absolutely.
Well,
time. Like in the U.S. right now, some common troublemakers are serovars called Grippottyphosa, autumnalis, and Pomona.
Okay.
And this directly impacts vaccines. Dog vaccines need to include protection against the serovars that are, actually common in that specific area.
Yeah.
It's targeted protection.
That makes a lot of sense. Okay, so it gets in. How does the infection actually take hold and spread? Sounds like it happens pretty fast.
It really does. These Leptospira, they're pretty adept at getting in. They can penetrate intact skin, believe it or not, or through cuts, scrapes, and definitely mucous membranes like the lining of the mouth, nose, eyes.
So they don't necessarily need an open wound?
Not always, no. And once they're in, they hit the bloodstream fast. We're talking maybe 4 to 7 days.
That's quick.
Yeah. And from the blood, they spread, pretty much everywhere else in the body in another, say, 2 to 4 days.
Wow. Okay, system-wide invasion. What are the first signs an owner might possibly notice?
Well, this initial spread, the body reacts. So you might see a fever pop up. The dog might seem off, lethargic. A blood test would likely show more white blood cells. That's the immune system responding. You might also see a temporary dip in red blood cells, a mild anemia, maybe some changes in the urine, like a bit of hemoglobin or protein showing up.
So the body's definitely fighting back. Does it usually win at this stage? Or does the damage continue?
It varies. Often that initial fever and the bacteria in the blood, we call that bacteremia, they do subside. But the bacteria aren't necessarily gone. They can then start causing more focused damage.
Damage where?
They particularly like to target the tiny blood vessels, the capillaries, and the cells lining them. This damage can sometimes lead to tiny little pinpoint bleeds, petechiae. You might see them on the gums sometimes.
Okay, blood vessel damage. And what about those main organs, the liver and kidneys?
Right. So in the liver, they can cause liver cells to die hepatic necrosis. That can lead to jaundice, that yellow look to the skin or eyes. And the kidneys. This is a major target. The Leptospira seem to settle into damaged kidney tubules, and they multiply really well there. This is what leads to them being shed in the urine leptospiruria.
Leptospiruria, okay.
And that's a really key point for you listening. When the bacteria are in the urine, the dog isn't just sick, they're potentially spreading the disease, even if they seem to be getting better. That's crucial for understanding transmission risk.
Right, so contagious even during recovery. That's important. What's the immune system doing while all this damage is happening?
The body does start making antibodies, usually around the time the bacteria are clearing from the blood. But if the infection's severe or the immune response isn't strong enough, the damage can overwhelm the system.
And that leads to?
Sadly, death can occur. Often it's from severe kidney inflammation, the interstitial nephritis, combined with the blood vessel damage, leading to kidney failure. Or sometimes it's a massive bloodstream infection, acute septicemia, or a nasty clotting problem called DIC.
DIC, okay. It sounds like this really can affect multiple parts of the body then. Can we maybe list out the main systems hit by lepto?
Sure. So we've mentioned the cardiovascular system, blood vessel damage, bleeding risk,
right.
The liver and biliary system, inflammation, cell death, dysfunction.
Okay.
The nervous system can even be involved, sometimes causing meningitis, which is inflammation around the brain and spinal cord.
Wow, meningitis too. Didn't expect that. And kidneys, obviously.
Definitely. The renal or urologic system is heavily impacted. Kidney inflammation, damage from hemoglobin release, direct damage to the tubules, potential failure. The respiratory system can also take a hit. Inflammation of lung blood vessels, vasculitis, or inflammation in the lung tissue itself, interstitial pneumonia.
It sounds like even if they pull through the acute phase, there could be lingering issues.
Exactly right. Chronic disease is a real possibility. That could mean ongoing eye inflammation, anterior uveitis, or chronic kidney failure that develops later, and even reproductive problems, abortions, weak puppies. It's also been linked, though less commonly, to stillbirths in cats.
This is clearly serious stuff. How common is it, though? Is this something, every single dog owner needs to be on high alert for constantly?
That's a good question. The true number of cases is probably higher than what's reported.
Why is that?
Because many infections are mild or even subclinical, meaning no obvious signs, so they just don't get diagnosed. But, and this is important, recent studies suggest it's actually increasing, especially in urban dogs. Hospital prevalence seems to have been climbing since the 90s. So, maybe not the most common thing, but definitely on the radar and seemingly becoming more so.
Increasing, especially in cities. Interesting. And where do we typically find lepto? Is it everywhere or more in the certain climates?
It's pretty much worldwide, but it definitely prefers warm, wet conditions. So more common in tropical and subtropical areas and during warmer, wetter seasons in temperate zones.
Makes sense, like a summer-fall thing in some places.
Yeah, often. And historically, two serovars often linked to dogs were Canicula and Icterohemorrhagiae. Canicula is sort of the most common globally, while Icterohemorrhagiae is big in places like Australia.
Are there others we should know about?
Well, there's L. bratislava, but its significance in U.S. dogs isn't totally clear yet. The key thing about where these bacteria live is they love standing water, damp soil, especially if it's neutral or slightly alkaline.
So that puddle after the rain, maybe not so innocent.
Exactly. It's not just about obviously dirty swamps. That seemingly clean puddle in the park, if the conditions are right and an infected animal urinated there, it could be a risk.
Okay. Environment matters. Thinking about our pets, who's most at risk. Does age or anything else play a big role?
Well, species first dogs way more than cats.
Right.
Then age, yes. Very young dogs, puppies without maternal antibodies, they tend to get much sicker.
Right.
Older dogs, if they have good antibody levels from vaccination or maybe mild past exposure, they often handle it better. Unless, of course, they meet a serovar that their immune system hasn't seen before.
What about like male versus female dogs? Does that matter?
Traditionally, people thought males got it more often. But some newer reports are questioning that. So sex might not be as big a factor as once thought. It really boils down more to exposure routes and individual factors like vaccination.
Okay, let's talk exposure. How do dogs actually get it?
Two main ways: direct contact and indirect contact. Direct means contact with an infected animals. Well, mainly their urine, but also potentially things like fluids after abortion, or even theoretically a bite, though urine is the big one.
And indirect?
That's probably more common. It's contact with a contaminated environment. So soil, water sources like puddles of ponds, vegetation, maybe even food bowls or bedding that have infected urine on them. The bacteria can survive out there for a while if it's moist.
So they don't need to meet another sick dog, necessarily.
Not at all. And remember wildlife. Lots of mammals, rodents are classic carriers, but also raccoons, skunks, deer, opossums. They can carry various serovars and shed them into the environment, basically seeding it for our pets. Call that spillover.
Wildlife acting as reservoirs. Makes sense. What about things about the dog itself? Like, does being vaccinated fully protect them?
Vaccination is super important, but it's not perfect. Here's the key. Vaccines protect mainly against the specific serovars included in that vaccine.
Right, like you said, it's targeted.
Exactly. So it significantly reduces the risk of severe disease from those serovars. But it might not completely stop infection if the dog encounters a different serovar. And sometimes even a vaccinated dog, if exposed, might still get colonized in the kidneys and shed bacteria in their urine, potentially without showing major signs.
So they could still spread it even if vaccinated.
It's possible, though vaccination likely reduces the amount and duration of shedding. There are newer types of vaccines, subunit ones, and research is always looking for broader protection. Lifestyle also matters hugely.
Oh, so?
Dogs that spend a lot of time outdoors, roaming, swimming in ponds, hunting dogs, they just have more chances for their nose, mouth, eyes, or any little skin breaks to contact contaminated water or soil.
So more exposure opportunities.
Precisely. And environmental factors play a huge role, too. We already mentioned warm, moist conditions, wet seasons, low-lying, marshy, muddy areas are higher risk. Stagnant water is worse than flowing water. Neutral to slightly alkaline water or soil helps the bacteria survive longer. They can last for weeks in wet soil or standing water if conditions are right.
And things like living in the city versus country.
Well, dense animal populations can increase risk. Think kennels, maybe even dog parks if sanitation isn't great, because there's just more potential for urine exposure. And in urban or suburban areas, proximity to rodents or other urban wildlife can also be a factor.
Okay, that gives a really clear picture of the risks. Now, the crucial part for owners. What signs should they actually look out for? If their dog does get sick, what might they see?
And this is where it gets tricky, because the signs can vary a lot. Depends on the dog's age, immune status, the specific serovar, how many bacteria they were exposed to, lots of factors.
So no single classic picture.
Not really. We often talk about it based on how fast it hits. So in really rapid onset cases, peracute to subacute, you might see things like a sudden high fever, the dog seems really sore, stiff, maybe shivering. Weakness, definitely loss of appetite, just seems depressed. Vomiting is common. They can get dehydrated quickly. Diarrhea, too, sometimes with blood.
Sounds awful.
It can be. You might see that jaundice, the yellowing, sometimes a cough or difficulty breathing. A big sign is often changes in urination, maybe drinking and peeing a lot initially, but then it can progress to them barely peeing at all or not at all, which is obviously kidney failure.
That's a really bad sign.
Yes. In females, bloody vaginal discharge is possible. And tragically, some dogs can just die very suddenly, almost without warning. That's why any sudden change, even if it seems vague, warrants a vet visit.
Definitely. Are there like slower, more simmering forms?
Yes, chronic leptospirosis can be much more subtle, maybe no obvious signs at all. Or just a low-grade fever that comes and goes, a fever of unknown origin. Sometimes the only sign might be increased thirst and urination, pointing to chronic kidney damage that resulted from an earlier, maybe unnoticed infection.
And if a vet examines a dog that's acutely sick with lepto, what might they find on the exam?
They might notice the dog is breathing fast, maybe an irregular or fast heart rate, poor circulation. Obvious signs like vomiting blood or bloody or dark, tarry stool. Nosebleeds sometimes. The gums might be very red initially, or show those little petechiae, those pinpoint hemorrhages, or even larger bruises. The dog might be really reluctant to move, painful if you touch their back muscles, walk stiffly. Maybe red eyes, conjunctivitis, or runny nose, rhinitis, blood in the urine on testing, and sometimes mildly enlarged lymph nodes.
That's a lot of possibilities, and frankly, some sound like they could fit other diseases too. How do vets actually pin down a diagnosis? Sounds challenging.
It absolutely can be. Ruling out other things is a big part of it. For dogs and cats, you have to think about immune diseases affecting blood cells, other infections, bacterial, viral toxins, kidney or liver tumors, trauma. Even things like tick-borne diseases can sometimes look similar initially.
Right.
And it's a reproductive issue. You'd consider things like brucellosis or herpes virus, too.
So not straightforward. What about lab tests? What do they usually show?
Lab tests are critical. Basic blood work, a CBC and chemistry panel, plus a urinalysis. These give huge clues.
Like what specifically?
Often signs of dehydration in the blood counts. The white blood cell count is usually high, fighting infection, though it can be low very early on. Platelets, which help clotting, are often low. Kidney values, BUN, and creatinine are typically elevated, sometimes dramatically. Electrolytes like sodium, chloride, potassium can be off. Liver enzymes are frequently high, too.
And the urine.
Key findings there often include protein in the urine. When the urine isn't concentrated properly, it's dilute, even if the dog is dehydrated. That's called isosthenuria, a classic sign of acute kidney injury.
Okay, so those general tests point towards kidney and maybe liver damage. Are there tests specifically for lepto?
Yes. The main one is serology, looking for antibodies in the blood. The standard test is the microscopic agglutination test, or MET.
MET, how does that work?
It measures the level of antibodies against different Leptospira serovars. The tricky part is, you usually need two samples. One taken early in the illness, the acute sample, and another taken maybe 3-4 weeks later, the convalescent sample.
Why two samples?
Because you're looking for a rise in the antibody level, the titer. In an unvaccinated dog, a low titer early on that jumps up significantly in the second sample is strong evidence of recent infection. Sometimes you can get cross-reactions between serovars, especially if the titers are really high to one type.
Okay, that makes sense for unvaccinated dogs. But what if the dog has been vaccinated? Doesn't that complicate the M test?
It definitely can. Vaccinated dogs will likely have some existing antibody titers, especially to the serovars in the vaccine. The levels might fluctuate depending on the type of vaccine and how recently they got it.
So how do you tell infection from vaccination?
That's why ideally you run both the acute and convalescent samples at the same lab at the same time. That lets you accurately compare. Even in a vaccinated dog, a four-fold or greater rise in the titer between the two samples is generally considered diagnostic of an active infection. A single high titer can be hard to interpret on its own.
Got it. Run both together, look for the jump. Are there other ways to diagnose besides blood tests?
A few others. Trying to see the bacteria directly in urine using dark-field microscopy isn't very reliable. A better urine test is the fluorescent antibody FA test. It can detect bacterial bits even if they aren't alive, maybe even after antibiotics were started. But the sample needs to get to the lab quickly, kept cold.
FA test on urine.
Okay. Sometimes giving a diuretic, like furosemide, shortly before collecting urine can help flush out more bacteria, increasing the chance of detection. And then there's PCR testing.
PCR, like for DNA.
Exactly. Polymerase chain reaction. It detects the bacteria's genetic material. It can be run on urine and sometimes blood early on or tissue samples. It's very sensitive and becoming more widely available, though still considered a bit newer for routine diagnosis by some.
What about trying to grow the bacteria? Or looking at tissues after death?
Growing Leptospira in culture is possible, but really difficult. They're very picky about conditions. After death, yes, examining kidney and liver tissue using special stains or FA testing can confirm it. PCR can also be run on tissues post-mortem.
Okay, so diagnosis takes some detective work. Once a dog is diagnosed, what's the treatment plan?
Treatment has two main goals: support the patient through the illness and kill the bacteria. Supportive care is absolutely crucial, especially early on. Fluids, definitely. Intravenous fluids to combat dehydration and support the kidneys. If there's severe anemia or bleeding, blood transfusions might be necessary. If the kidneys have shut down and aren't making urine, after rehydration, we might try diuretics. In really severe cases, dialysis is sometimes an option, though not widely available or always feasible.
Right, intensive care. And the antibiotics.
Yes, antibiotics are key to eliminate the Leptospira. Often, injectable penicillin G is used initially, especially while kidney function is poor. Then, to clear the bacteria from the kidneys and stop shedding in the urine, an antibiotic like dihydrostreptomycin is often recommended, though availability can sometimes be an issue. Streptomycin is an alternative if kidney function is okay.
Any other option?
Doxycycline is another excellent choice. It can be given orally or IV, and it's effective against both the bacteria in the blood and those hiding out in the kidneys, helping to stop shedding.
Are there risks with these drugs, especially with damaged kidneys?
Yes, you have to be careful. Aminoglycosides like streptomycin need cautious use if kidney function is bad. Penicillin doses might need adjusting too. There are alternatives like ampicillin, amoxicillin, or azithromycin that can also be used. And follow-up is vital monitoring recovery, rechecking kidney values.
You mentioned earlier that people can get this from pets. What's the most important message for owners whose dogs are being treated?
Absolutely critical point. Client education on the zoonotic risk. Owners must understand that lepto can pass to humans, primarily through contact with infected urine.
So precautions are needed.
Yes, strict hygiene. Wear gloves when cleaning up urine accidents or handling bedding until the treatment course, especially the part aimed at stopping shedding, is complete. Wash hands thoroughly and frequently. Discuss specific precautions with your vet. It's really important for protecting the whole family.
Okay, super important. Now, prevention is always better. What's the main strategy to stop dogs getting lepto in the first place?
Vaccination is the cornerstone for dogs. We have the traditional whole cell bacterium vaccines and the newer subunit types. They typically cover the most common serovars in a region, often Canecla, Bictohemorrhagiae, and now frequently Pomona and Grippa typhosa are included too.
Right. We talked about the limitations, though not always preventing infection or shedding completely.
Correct. Immunity is mostly serovar specific. And the duration of immunity isn't usually super long, maybe a year or less sometimes. That's why annual booster shots are standard. In high-risk areas or for dogs with high-risk lifestyles, some vets even recommend vaccinating every 6 months. Definitely a conversation to have with your vet based on your dog's specific situation.
So talk to your vet about the right schedule. What else besides vaccination?
Good management helps. If you have multiple dogs, keep things clean. Minimize urine contact. Rodent control around your property is important. If a dog is known to be a carrier, they should be treated and potentially isolated during treatment.
And for any dog owner.
Try to limit their access to risky environments. That means avoiding swimming in or drinking from stagnant ponds, marshy areas, slow-moving streams, maybe heavily irrigated fields. Minimize contact with wildlife. Be mindful of areas with lots of rodents.
What about the bacteria in the environment itself? Do they last forever?
No, thankfully. While they can survive in moist conditions, they don't multiply out there. They're quite susceptible to drying out, UV light from the sun, and freezing temperatures kill them too. Good sanitation helps break the cycle.
Okay. Even with treatment, can there be long-term problems after a dog recovers from lepto?
Unfortunately, yes. Some potential complications include that serious clotting disorder, DIC, permanent kidney or liver damage leading to chronic dysfunction is possible. Chronic eye inflammation, uveitis, can occur. And as we mentioned, reproductive issues like abortion in females.
And finally, what's the overall outlook? If a dog gets diagnosed, what's the prognosis generally like?
Well, remember, many infections might be mild or go unnoticed. But for the dogs that get acutely, severely ill, the prognosis is often guarded. It really depends on how severe the organ damage is, how quickly treatment is started, and how well the dog responds. Early and aggressive treatment definitely offers the best chance for a good outcome.
Right. Time is critical.
Yeah.
Okay, let's try to boil this down. Key takeaways for everyone listening.
Okay. Leptospirosis. Bacterial disease, mostly dogs, spread by infected urine or contaminated water soil. It can cause serious kidney and liver damage.
And early diagnosis and treatment are really crucial. Vaccination helps a lot with prevention, but it's not a silver bullet. It protects mainly against specific types.
Exactly. Be aware of the risks in your area and for your dog's lifestyle. Know the signs: sudden illness, fever, lethargy, vomiting, changes in thirst or urination, jaundice. If you see anything concerning, get to the vet quickly.
Definitely. And maybe a final thought to leave everyone with. We heard lepto seems to be increasing even in cities, and it can affect people. What does that tell us, maybe, about the bigger picture? About how animal health, human health, and our shared environment are all, connected? Something to think about.
Really does highlight those connections, doesn't it? The interaction between wildlife, domestic animals, and the environment we all share.
Absolutely. Well, thanks for helping us navigate that complex topic.
Right.
And thanks to all of you for diving deep with us.